Hey,
Hey.
let me tell you what happened to me.
Yes.
So, when I had my daughter,
Mm-hmm.
I lost my period. When you have
Like
a
for
baby,
how long?
yeah. So, when you have a baby, you don't really know when your period's coming back.
Mm-hmm.
And you ask your doctor, and they're like, well, it could come back after a few months or a long time.
Yeah.
Um, but with her, I breastfed her for 6 months. And so I didn't expect to have my period when I was breastfeeding, and
Mm-hmm.
I didn't. Um, but she was my second child.
Yeah.
So with my first child, I breastfed him for 9 months. And then once I stopped breastfeeding, my cycle came back like in a month.
Okay.
So that's kind of what I was
Pretty
expecting.
typical.
I
Yeah.
stopped breastfeeding and
Mm-hmm.
then I expected my cycle to come back.
Yeah.
And it didn't. And so I was like, well, maybe my cycle just comes back after 9 months. I
Mm-hmm.
could stop breastfeeding after 6 months.
Yeah.
So I just kind of waited. It hit the 9 month mark and still nothing was really happening.
Yeah. That must have been freaky.
Yes.
Yeah.
Yeah. And I mean, on the one hand, it was kind of nice,
Yeah.
right? Like, don't
But
have to deal with my
nice,
period.
but also like, what?
Exactly. Like,
Yeah.
something's going on here. And I was tracking my cycle and tracking my cervical mucus.
Okay.
And that was getting frustrating
Mm-hmm.
because there was very little mucus or just little patches of sticky mucus.
Mm-hmm.
And I
Yeah.
didn't know what to do with that.
Yeah.
Nothing that was clearly saying my fertility was coming
Right.
back.
Right.
So that was another thing where I was like, is this okay?
Yeah.
So I kept waiting, and then it had been a year since my daughter was born.
Mm-hmm. And no clear signs. So we're talking about like ovulation mucus. Yeah.
Yeah, none at all. So I reached out to my instructor, my charting instructor, and she was like, yeah, this seems like something's going on here.
Mm-hmm.
Like, you should be looking into this.
Yeah.
Like, it's been now 6 months since I stopped breastfeeding,
Right.
and still no signs of ovulation mucus and no period.
Right. But because you were charting, you were able to have a sense of like, well, my body's kind of starting, but it's not this like full blown normal ovulation that you're used to. Right? Okay. Because you knew from charting, like kind of where your body was. So cool. Yeah.
Exactly. And so because of that, because I was charting and I knew that something wasn't quite right with my chart, and then my charting instructor confirmed, I don't think something's quite right.
Yeah.
I was able to go in, get some lab work done, evaluation
like with
done.
your charts.
Yes.
Right.
And find out that something really wasn't right. I had low estrogen levels. My body wasn't making estrogen. And so I was diagnosed with hypothalamic amenorrhea. But if I hadn't been charting, I don't know when I would have started questioning. If I wasn't charting, I wouldn't have had more signs to tell me that something's not right besides just not having my period.
Right.
So I wanted to tell you this because I wanted you to have an example of how charting can be so helpful outside of fertility.
Right. Because then weren't you able to use your charts to track your healing?
Exactly.
Right? Like,
exactly.
And then it's so cool because I've also had that experience of like having a hormonal challenge, doing an intervention or like what we call like a treatment. And then you're able to track when things are starting to get back to normal. So you were able to use that pattern to kind of like wonder like maybe there's a diagnosis, maybe there's something that's off, but you were also able to use it.
Definitely.
How did that look like for you?
Definitely. Yeah. So I mean, the healing was definitely a long journey. And definitely there were some lifestyle things that needed to change.
Like how long would you say it was from the time you started to do treatment to like having your charts look more normal for you?
Like 6 months.
Okay. That's like that's pretty doable though.
Yeah.
a lot of women with chronic illness are sick for years. So you were able
Right.
to expedite that.
Yeah.
Yeah.
Yeah. And I think it was because, well, partly because I was paying attention to what my chart was saying.
Mm-hmm.
And I was able to see, if I make this change, is that making any difference in
Yes.
specifically my cervical mucus or
That's
not?
so powerful.
Definitely.
Yeah.
Definitely. And then what I was able to see is that I was able to see evidence that I really was healing
Mm-hmm.
before my period even came back.
Yeah.
I started getting ovulation mucus, which I hadn't had since before my daughter was
Yeah.
born. And then it was a few weeks later that I got my first period.
Yeah. Yeah. It's almost like I equate it to like, when you're growing a plant and you like you're like, so I'm growing tomatoes right now because it's summer, and like I know the tomatoes are going to come because the plant went from being this big to like being this big, and there's flowers, and we know that like when there's flowers and the fruits coming, it's like understanding your cervical mucus and your chart is like, that the whole system is healthy.
Yes.
The fruit is like your period. It's like the cherry on top. Like, yeah, that's the thing. But a lot of people, if you're not charting, you only have like the presence of the fruit to know that there's a whole tree that's healthy.
Right.
But like you were able to understand the whole picture, which is just so cool.
Definitely.
Yeah. So we really want you all to know that this tool is available to you, that your body is showing you lots of different signs that you can use to watch for these patterns, just like what Emily did, to begin to have a dialogue with doctors. That's what our next module is all about. It's like, how do you actually like collect the tools, repackage them, and be like, doctor, can we make this situation something we can work with that's more clear? Right?
Yeah, definitely. And having your cycle and having this information about your cycle can help you achieve whatever health goals you have. So for me, in this time period when I had that diagnosis, my main goal was to get my period back.
Yeah.
I knew that I wanted to be open to the possibility of having more children in the future. And so I knew that I wanted to have my fertility back. And I knew that having the cycle is healthy for my body. And I wanted to be restoring my body back to its normal functioning.
And that's, I think, a message that we don't always hear, that like we really believe that like healthy women have healthy cycles.
Yes.
And it's awesome if you want to have a healthy cycle, because when you have a healthy cycle, it's easier to get pregnant. But also having a healthy cycle is a big indicator that your whole system's healthy.
Yes.
So we just really want to invite you guys to understand that you can use this system for whatever health goals you have. So Definitely. It could be like achieving pregnancy, avoiding pregnancy. Our specific system you wouldn't use for those directly, and we have a whole module like on how you can get really good at finding a system that matches that. But for things like exactly like what you went through, like my period's not there, when is it coming? Or for me, I've struggled with PCOS, so I'm always using my chart as like an indicator of like, is this treatment working? Is it not? How can we adjust it? So,
yeah. And so I think part of that too is being clear on what are your health goals. Because then exactly you can use your information however you want to use it. So I know as a coach, Sophie, that you're really good at helping people identify goals and some ways on how can you make a clear, reachable goal for yourself, especially when it comes to your health.
Well, I think that the first step always is getting awareness. Like, where are you in relationship to where you want to be? And so I think that charting is a really helpful skill to have to begin to develop that awareness, so that you can know that where you're going is a place that you have a path to, and that there's measurable, like, okay, I know I'm hitting my goal when my cycle is 28 days or 32 days, whatever's normal for you. So I think that it's really helpful to allow yourself that grace period to spend time getting awareness. And I think that the other piece that like really has to precede that is figuring out what's normal for you.
Mm-hmm.
Like we read about like 28 days is the cycle, and that's not true for everybody.
Right.
And so charting in this way allows you to understand your health goals better because you first have a sense of who you are, where you are, and
Mm-hmm.
then you can figure out where you want to go. And I think with health goals specifically, it's helpful to work with your doctor.
Yeah.
And keep up that level of awareness. So, for example, let's say a person is wanting to like lose 20 pounds because their doctor has said that that would be an appropriate goal for them. You can use your chart to monitor, like, is your body doing okay with the way that you're doing it?
Yeah.
Because if you're like using a method where you're cutting calories all the time or just totally changing up your eating patterns, if that doesn't work for your body, it's going to show up in your chart.
Definitely.
And so I really like the idea of having charting as a piece of your goal because it allows you to actually have healthy goals, ones that aren't going to like deconstruct your hormonal system.
Right.
So it really allows, a deeper level of health, I would say.
Yeah, that makes total sense. And it's exactly what we said. Healthy women have healthy cycles.
Yes.
So if you're trying to do something that's healthy, like if losing weight for you is healthy, but you're doing it in a way that is stopping your body from cycling normally, then the path that you're getting is not a healthy path.
Right.
And so then you can do some course correction.
Right.
And you might be, watching this and thinking, well, I haven't been diagnosed with hypothalamic amenorrhea. I haven't been diagnosed with PCOS. Like, I don't really need my chart for health. But I think that's one of the key things about charting. Exactly like you said, you learn what's normal for you. You learn your body better. And then if you notice that something is off with your cycle, if cycle after cycle, your cycle length is getting shorter, or your luteal phase is getting shorter, or you're not ovulating, then that's a sign for you, even before maybe you notice any issues with your periods. Seeing it in your cycle can clue you in that, okay, yes, it's time to talk to my doctor or practitioner.
Right. It's like if you look at just to go back to the tomato plant example, like if you had a plant and you saw that like all of the leaves had like been eaten through with mites, you would know that there's something that needs to be addressed long before you see anything with the tomatoes. And it's a little bit like that. I mean, charting your cycle for your health allows you to use it as like an indicator light. So you might have years of normal charts, which would be awesome. I mean, I hope everybody has that. But let's say you have that, and then all of a sudden you're starting to have like no ovulation mucus. Like just like you said, it's such like a powerful tool. I can't even express enough like how that early detection piece can be, I mean, life-changing for people. Definitely. To be able to go into your doctor quickly.
Definitely.
Yeah.
Definitely. And getting more specific, we talked about when we reviewed the menstrual cycle, how the different parts of your menstrual cycle are related to different hormones, mainly estrogen and progesterone. And so, do we want to stop and do that?
How do we pause?
No. So to be even more specific about it, when we in an earlier module talked about the menstrual cycle and we reviewed what's going on in your menstrual cycle, different parts of your cycle are related to specific hormones. So specifically, we talked about estrogen and progesterone. And so if you recall, that first half of your cycle, that time before ovulation, is most tied to estrogen. And then that second half of your cycle, that time after ovulation, is more tied to progesterone. So that's another tool that you can use when you are talking to your doctor or practitioner. And we'll talk about this more in the next module, is that you can specifically say, I think I might have something going on with my estrogen or something going
Yeah.
on with my progesterone because I'm seeing this in my chart. And your, practitioner might not be as familiar with your charting, but they are going to be familiar with
Those
estrogen and
hormones. Yeah.
progesterone
Yeah.
for sure.
Yeah. And that's actually a piece that we go into way deeper in the next module, because we really want you guys to have, like exactly what Emily said, that language that
Yeah.
even if they're not charting, like the charting is just a way to map out the hormone patterns, and they know that piece. And so, just another example that comes to mind with those patterns, because that's kind of the whole point, is to like get to know your patterns and get to know when the patterns are shifting.
Yeah.
I think a really common one actually is when people are thinking about getting pregnant. Um, when they begin to chart, they might very quickly realize that their luteal phase, so like what Emily was talking about, the second half of their cycle, is shorter than they are reading about it should be. And that's like a super easy way to like quickly understand, like, okay, this is the part of my cycle that's off. I can go to my doctor and they can help me with treatment. Versus like the current recommendation is to try to get pregnant for a year before seeking medical care.
Right.
And that is a good recommendation for people who aren't charting. But if you're somebody who's charting, you're going to just be able to see these patterns so much sooner. And I just think that's such a beautiful thing.
Yeah.
I'm like so much less stressed.
Definitely.
To like, yeah.
Yeah. And it helps you, be more in charge of your health. And have some more, not necessarily control over it, but I think you can be a better advocate for yourself when you say, this is what's going on. I've been trying and I've seen these symptoms and this isn't happening.
Yeah.
Versus when people aren't charting, they're trying, they might not even know when the right time is to try. I shared a story about that earlier. That, using charting in that way can help you key in on something sooner than later.
Right.
The other thing, I do work with a lot of people that are family planning, but something that I really emphasize is that even to my couples who are using charting for avoiding pregnancy, a lot of them want to become pregnant in the future. And unfortunately, a lot of women don't find out that they're having any hormonal or cycle issues until they're very motivated to get pregnant. Right. They're not charting until I want to get pregnant next cycle. But if you're charting ahead of time, especially if you're in that phase where you're like, I don't want to have kids now, but I do down the line, then if you see something off with your patterns, you can look into it. You can get treatment now.
Way before.
Without the pressure of, oh my goodness, we have to do this has to work,
I have to get healthy and I have to get pregnant. And it's so much kinder for the body too, to like have a period of time to have that healing. Because a pregnancy is, a big shift for the body. And the same is true like on the other side too, I was thinking of, we don't talk about menopause so much in our culture, but it's similar. Like you want to go into menopause with a healthy cycle, because that's going to allow that transition period of your life to be so much smoother. And you don't want to have to be like, okay, menopause is happening. Now I'm going to look at my hormones.
Right.
And, there's a lot you can still do, but it's just so much less stressful and easier for the body if you go into these big, female reproductive events with a healthy cycle, and do that by knowing your patterns, and you can get really clear, I think, on your goals that way. So anything else?
I don't think so. I think the other thing is when you are figuring out what is normal for you, it really is a pattern. So even if you have been charting for a few months and you kind of have a feel, this is what my cycle looks like, and then one cycle something is off, it's normal to be off for one cycle. Maybe you had an illness, maybe you had stress, maybe even if you didn't realize that you were super ill, maybe you were just exposed to a virus, or maybe there was some other kind of environmental exposure that you had and it affected your cycle. also don't need to freak out because you have one cycle that's off. It really is important to establish a pattern, but then too, you have this sign that, okay, something might be off. And then if you continue to see something off cycle after cycle,
Yeah.
that's when you would want to seek help.
Yeah. So we usually say like it's around 3 is kind of the point in which you'd seek help, unless it's something major, like, you know, we aren't going to go through like all of the health things,
Right.
but it's like these subtle patterns.
Yeah.
It's around that 3-month mark. So
right. If you have some sort of like significant bleeding that's
Yeah, that's what I was
abnormal
gonna
for
say,
you,
yeah.
or significant amount of pain, like those are
like,
warning
you
signs.
trust yourself.
Yeah. But again, charting is such a tool for knowing your body and knowing your health.
Yeah. It's a huge gift, honestly.
Yeah.
Thank you.